Ebola is a deadly virus spread through contact with infected bodily fluids. Ebola has no cure. It must be contained. What began as a single case in a remote West African village has become the biggest outbreak of Ebola the world has ever seen. The number of cases is rising at an alarming rate. Without further intervention, the CDC predicts there will be over 1 million cases in Liberia and Sierra Leone by January. And there is a complete lack of facilities to cope with the rate of increase. Many patients are turned away from treatment centers. Entire families are being infected with little protection. In the U.S., we have directly experienced the fear that is carried with this deadly virus. The world has been forced to take notice. However, the promises of aid have not resulted in change on the ground.
Despite the media attention, despite the high-level talks, the amount of money that's been pledged, we're still not seeing action fast enough on the ground.
Families of Ebola victims left behind become even more vulnerable. The worst affected are children, who become orphans of Ebola, like 7-year-old Martina Laroma and her brother Martin, who is just 3. GOAL has been working in the region for more than 25 years, providing life-saving services. GOAL has an established presence and strong relationship with many affected communities, a relationship that is proving vital now. Our teams face their own fears to reach communities and raise awareness on how to stop the spread of Ebola. We support survivors with household kits, clothes, and reintegration counseling due to intense stigma. GOAL donates a number of vehicles to local health workers to help them bury bodies and transport health staff. We also provide life-saving emergency protective equipment to hospitals and clinics. Without these tools, infections of brave nurses and doctors are inevitable. GOAL is doing everything that we can, but there is so much more that we can do with your help. Help us to stop the spread of Ebola and support those who have survived. Please give generously. Thank you for supporting our life-saving work.